Hi, Dr. Pelto here. This week I want to go over a few common questions that some of my patients had here. Just a reminder, you can post it underneath this video, or you can also just go to my website, drpelto.com, and post a question there. Okay, so let's look into this here. So this week we're going to look at a wart that took a long time to get rid of, but it finally totally went away. Some questions about after removing toenails, kind of a newer procedure we're doing this time of the year a lot. It's called Cariflex, and something new that's called Onifix, which is something that helps with ingrown toenails. So let's get right into it. The first is a patient's question. She says, hi, I really need your help. I have 2 fungal toenails. My doctor removed the whole nail, which was painful in the procedure, and the gauze stuck to it. It took me a whole night to get courage to rip it off my skin. That sounds like it hurts. And after that, I didn't take my medicine, which was probably an antifungal, and it grew back with a fungus. I don't know. I don't want to remove it again. It also stopped growing. So we're going to talk about a few options and with this. First, let's talk about the gauze. So this is an example of a patient that had the toenails removed. What I recommend is when I put a dressing, I usually do a triple antibiotic with a gauze on it. Or sometimes I use a non-stick dressing, so you can use a non-stick dressing. If the gauze sticks, you want to soak your foot for a long time in some salt water, and then you have to slowly pull it off or just yank it off. It might bleed a little bit, and that is normal, okay? That is normal for that to happen. So that was the first question. What do you do if it's slow growing? One thing is you can take a biotin, which can help nail growth, but this is an example of a patient that had kind of a bad slow growing nail. It maybe had a little fungus or it was different. And we did something called Cariflex. This is a procedure where we add this resin and it makes it look much better. It's not perfect, but it's much better, especially when it's painted. That's what you do. Underneath this video, I have some information about Cariflex if you want more information, okay? Another example of a patient that came in today, you can see that she has this kind of weird nail. It might have a fungus, but I put the Cariflex on and it looks so much better than it did before for the summertime. You can just paint that. Okay. Another question a patient had for me, can I go swimming after a procedure? So this is a matrixectomy. Can you go swimming after this? Yes, you can go swimming. I recommend more salt water because it's just like soaking in salt water. But if you need to go into the lake, just make sure it's a clean lake. I tend not to recommend too much lake swimming initially for the first couple of days until things calm down. But swimming is very similar to soaking after a nail procedure. This is a matrixectomy where the nail was killed. And then kind of I'm very proud of this patient. So I put underneath this video kind of my protocol of getting rid of warts. Unfortunately, you can't do most of it yourself, but what he did and what worked for him, and I don't know why it worked now and not 6 months ago when I started seeing him, but I do laser treatment to zap it. And so I trim off all that hard skin, laser treatment to zap it, and then I put Cantharidin on it, or Canthrone. It hurts really bad for about 5 days. And then afterwards, he starts doing some topical salicylic acid with like a pumice or something to buff off and get all this stuff off after he showers. That's what he did. Now it took I want to be very upfront. I think we were treating with this for six months until it finally healed. We already tried to remove it once. So I removed it. You can see the scar in this picture right here. We removed it, didn't work. And then eventually these other things just happen to work. I think it's the whole immune response. Once again, all these are getting your immune system to work. A newer procedure right here, you can see it at the base of the nail. This is called Onifix. It's just a way to treat ingrown toenails without surgery and without an injection. So it's done in some other countries. It's starting to be used in the United States. The whole idea is that you put it on the base of the nail. As the nail grows out, it tends to want to go into the direction of least resistance, and so it'll get an ingrown toenail, and you cause resistance with this little thing that's applied on the top of the nail. It causes resistance and helps, kind of like a braces for your teeth, that as it grows, it's going to grow straight. We're excited about this new thing. A lot of doctors are starting to do this as well. And then finally, the last question, patient came in, you can see a little fuzzy here, but this is a child, about a 6-year-old child, really kind of thick, bad toenails. What do you do for this? Well, the doctor gave them a topical ketoconazole, which is an antifungal topically. That's really not going to work. Most antifungals topically aren't going to work. Laser, I wish it would work. Really, the only thing you have is either deal with it until they turn 18, so that's 12 years. The challenge with this is a 6-year-old, they probably don't care. The parents don't care. Not that they don't care, but it's not as harmful or shameful. But in the future, it's going to be. So I would probably put this patient, based on weight, oral Lamisil or terbinafine. So basically, the normal dose is 250 milligrams for 12 weeks or for 3 months. What you would do is based on weight. So for example, if they're 90 pounds or below, or between 45 and 90 pounds, you would put them on half the dose. Okay, so you'd put them on 125, and then you would cut that 125 in half if they're under 45 pounds. That's how this works in terms of dosaging. 12 weeks, probably get liver tests. You have to ask the pediatrician if it's okay. But, this is just a really bad fungal infection to live with. Once again, you can ask your own question or schedule an appointment. You can go to drpelto.com for that. Thank you. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.